There's been a lot of misconceptions about vaccination, hesitancy about vaccination. In the beginning, it was much more than now. About the adverse effects, about the clotting, about you know lack of efficacy, and this is coming up again because a whole lot of healthcare workers who had actually had 2 shots of vaccine almost 1 month or 2 months back are getting coronavirus infection. It has happened in my hospital also, Gangaram Hospital, Vedanta. Every hospital is having. So there is people are disheartened. मेरे को वैक्सीन भी लग गया और so इसलिए my take would be that why we are so petrified by coronavirus because of the severe disease, because of the death, because of the disability that it causes. And now there is more and more scientific and sufficient evidence that there is 100% protection against severe disease. So therefore, I would urge and wish to have trust in the vaccine. It is absolutely safe, and on the severity front, it is effective. We don't have data of effectiveness. There's a difference between efficacy and effectiveness. Efficacy is in the controlled environment. Effectiveness is now will be known when it is in the community. We will know if somebody is monitoring those things. But I think there's a tendency to blame public that they are not using masks, they are not using this, blah blah, they are not using this. But I still feel that vaccination is the most potent weapon today to combat this pandemic, as is being done in UK, USA, Israel, and other countries. So our country should also enhance the vaccination program so that we control this. How does the vaccination work? Now, this is as the virus infects a cell, it's the spike protein which actually stimulates the formation of antibodies. So what you are doing in the vaccination is that you are giving a stimulant, that is an antigen, either in the form of a killed virus or in the form of live attenuated virus, that is that is with the vector that you give it, or you give it by giving a DNA or messenger RNA, which actually stimulate the production of antibody. The antibodies are produced are active against the spike protein of the virus. Spike protein is the protein which is responsible for penetration of virus. So step 1 is that you inject the killed virus. Step 2, it activates the immune cells. Then step 3, that it builds the antibodies, and of course the cell-mediated immunity is also equally important. So what are the effects of vaccination? How does it benefit us? So if there is no mass vaccination, this blue are the unvaccinated people, as we were in India. The one case would actually infect so many people. You can see this red. However, if the majority of people are vaccinated, as you see in the gray dots, and there's a one case, he will infect one person, he infects other person, but since these people, these people are vaccinated, so this will block the chain of transmission, and this is what is called the efficacy of the vaccine. I'm sure all of you know. So many people get COVID infection. As I said, the immunity after the first dose develops within 2 to 3 weeks, which is a mild immunity. The optimum immunity occurs 2 weeks after the second dose. And this is not answer to the question. The answer to the question is, if he has developed COVID infection, he should wait at least, I would use the word at least, for 6 weeks from after recovery from the COVID infection. Then he should consider a second dose, but he could wait even longer because he would have had antibodies to COVID because of the infection also. But 6 weeks is minimum.
Okay.
coronavirus mutates. The longest immunity, antibody immunity, which has been documented with coronavirus is of 7 months. It is also true that after 3 months, the antibody level starts waning. So the common sense says that it would require a booster. It would require a booster, but no one knows till now how often, every year or 9 months later. Only the time when and studies conducted will tell us whether. To my mind, if you ask me heart of my heart, I know. I think the booster would be required, but there's no scientific data.